Welcome to Finn-Kool's annual employee safety training. In this training, we will cover workplace safety and health, personal protective equipment, violence in the workplace, an emergency action plan, fire extinguisher essentials, bloodborne pathogens, hazard communication, first aid, and powered industrial trucks. Workplace safety and health. Everyone has a role in keeping the workplace safe. You are entitled to a safe workplace and to speak up about hazards without fear of retaliation. The three core elements of an effective workplace safety and health program are 1. Management leadership, 2. Worker participation, and 3. A system for finding and fixing workplace hazards. Here are some key guidelines to remember to ensure back safety at work. Lift objects with your legs, not your back. Keep your feet apart. Hold the load close to you. Lift it in one smooth motion. Turn with your feet, not your waist. Slips, trips, and falls. Common causes of slips, trips, and falls include slippery materials and surfaces, inappropriate footwear for the surface, uneven walking surfaces, loose rugs or mats, exposed or loose cables, and clutter on the floor or stairs. In order to prevent slips, trips, and falls, you can take steps such as cleaning up all spills and debris immediately, marking or identifying spill and wet areas, keeping walkways clear of clutter, covering or taping down cords or cables, selecting and wearing the proper footwear, match your footwear to all the hazards of your job, and keep your shoes in good condition. Safety in temperature extremes. Heat safety means we take steps to prevent heat illness at work, such as easing into work, drinking cool water even if you're not thirsty. It's recommended to drink about 16 cups a day. Taking breaks, wearing a hat and dressing for the heat, which means light-colored clothing and loose-fitting clothes. Eating a well-balanced diet, limiting sugary drinks, and getting plenty of sleep. For cold safety, limit outdoor activity as much as possible. Dress in warm layers, drink warm beverages, cover any exposed skin, monitor yourself and others for signs of frostbite and hypothermia, and check on your coworkers frequently. Know the signs of heat illness. Heat exhaustion can display symptoms like fainting or dizziness, excessive sweating, rapid weak pulse, nausea or vomiting, cool, pale, clammy skin, muscle cramps. Help the person get to a cool, air-conditioned place and encourage them to drink water if they're fully conscious. For heat stroke, symptoms can include a throbbing headache, loss of consciousness, rapid, strong pulse, nausea or vomiting, body temperature above 103, red, hot, dry skin, and no sweating. Call 911 and take immediate action to help cool the person until help arrives. Personal protective equipment. Examples of PPE include safety glasses, goggles, face shields, respirators, safety toe boots, gloves, earplugs, earmuffs, and fall protection harnesses. Finn-Kool provides PPE such as safety glasses, safety toe boots, respirators, gloves, earplugs, and fall protection harnesses to all employees that need them at no cost. All Finn-Kool employees are required to use PPE and need to know when is PPE necessary, how to properly put on, take off, adjust, and wear, proper care, maintenance, useful life, and disposal, what type of PPE is necessary, and the limitations of that PPE. Mandatory PPE use. Safety glasses and goggles are required whenever there's a risk of flying particles, liquid gas, chemicals, or harmful light radiation. Face shields and respirators are required when workers need a higher level of defense against particles in the air like major splashes, heavy flying debris, or intense heat, often used in addition to safety glasses for tasks like grinding and pouring chemicals. Safety toe boots are required when working in areas where there's a danger of falling or rolling objects piercing the sole, or where feet are exposed to electrical hazards. Gloves are required when exposed to hazards such as skin absorption of harmful substances, severe cuts, abrasions, or punctures. Earplugs and earmuffs are required when the noise levels reach or exceed an 8-hour time-weighted average of 85 decibels, or when engineering controls cannot reduce the noise to safe levels. Full-body harnesses are generally required when working at heights of 4 feet or more in general industry or 6 feet in construction. How to properly wear, adjust, and remove PPE. Safety glasses and goggles to wear, ensure that they sit snug against the bridge of the nose, adjust temples or straps so there are no gaps. To remove, pull forward away from the face by the temples or straps and avoid touching the lenses. Position face shields centrally over the face. Tighten the headband so the shield doesn't slip when you move. To remove, lift from the back of the headgear upward. Lace safety toe boots tightly to support the ankle and ensure the steel or composite cap doesn't rub against the toes. Untie them completely before removing to maintain the boot's structural integrity. Choose the correct size of gloves. Pull the cuffs over or under the sleeves depending on the splash risk. Pull from the cuff, turning them inside out as you remove them to avoid skin contact with hazards. For earplugs or earmuffs, for plugs, roll them into a thin cylinder, pull the ear up and back, and insert. For muffs, ensure the cushions seal completely around the ears. Remove them slowly to prevent a sudden pressure change in the ear canal. Connect the leg straps of a full body harness first, snug enough to where 2 fingers fit between your leg and the strap, and ensure the D-ring is centered between the shoulder blades. Disconnect the chest strap last and ensure the gear is hung up, not dropped. Care, maintenance, useful life, and disposal. For eye and face gear, clean it with a mild soap and water or dedicated lens wipes. Store in a protective case. Dispose of or replace when lenses are scratched or if the frames are cracked. For safety toe boots, clean off mud and chemicals daily and use leather conditioner or waterproofing as needed. Dispose of if the toe cap is exposed, the tread is smooth, or the sole separates. For gloves, wipe off surface contaminants, store away from direct sunlight and heat. Dispose of immediately if there are punctures, tears, or chemical stiffness. For hearing protection, with earmuffs, wipe the cushions. And for plugs, only reusable ones should be washed. Disposables are single use. Replace earmuff cushions if they harden, and toss disposable plugs daily. For a full body harness, wipe the webbing with a damp sponge and hang in a cool, dry place. Dispose of immediately if it has arrested a fall or if any webbing or stitching is frayed or burnt. Limitations of the PPE. Safety glasses cannot protect against fine dust or heavy chemical splashes. Goggles should be used instead. Face shields do not provide adequate impact protection alone and must be worn with safety glasses. Safety toe boots do not protect against extreme crushing forces beyond their rated capacity. Gloves cannot protect against all chemicals. There is always a breakthrough time. Earplugs or muffs do not block all sound, they only reduce exposure. Improper insertion reduces protection to near zero. Full body harnesses are only effective if the anchor point is rated for 5,000 pounds. Does not prevent a fall, it only stops it. Violence in the workplace. What are the signs of potential workplace violence? Disrespect for authority, extreme emotional changes, increased mistakes in work, refusal to acknowledge job performance issues, social isolation, grudges, angry outbursts, excessive absenteeism, or lateness. 1 out of 6 workplace deaths are because of violence. So what do you do if you suspect someone might become violent? First, stay calm. Alert your manager and human resources. If you fear for your safety, avoid the person completely. There are 4 main types of workplace violence. Criminal intent, which is aggression between people who don't have a relationship with the employee or the establishment. Customer or client, it's violence from an employee while performing their duties involving a client of the workplace. Worker on worker, which is aggression between 2 or more employees in the same workplace. Personal relationship, which is violence involving people who have a personal relationship outside of the workplace. Emergency Action Plan. What is an emergency action plan? It is a written procedure that outlines how to respond to different emergencies. Where can you find Finn-Kool's emergency action plan? The digital file is accessible via all kiosks, and the human resources can provide a physical copy upon request. What should you do in the case of an emergency? In case of a tornado, go to the main building bathrooms. In case of a fire, meet in the grass ditch by the driveway on the north side. In case of a blizzard, stay indoors. This is a map of our shop. The bathrooms below the production office are where we will meet in the case of a tornado. If there is a fire in or around the shop, all employees will meet in the grass ditch on the north side of the driveway. Fire extinguisher essentials. Water fire extinguishers can be used on paper, wood, coal, cardboard, and other solid fuel fires. Foam can be used on solid fuel fires as well as flammable liquids. Powder fire extinguishers can be used on any kind of fire except for Class F cooking oils. CO2 fire extinguishers can be used on flammable liquids and electrical fires, and wet chemical fire extinguishers can be used on cooking oil fires as well as combustible solid materials. Fire extinguisher classes. Class A is for ordinary combustibles like wood, paper, cloth, trash, plastics, and other solids. Class B includes flammable or combustible liquids or gases like gasoline, oil, petroleum, greases, tars, oils, oil-based paints, solvents, lacquers, alcohols, and flammable gases. Class C can be used on electrical fires. Class D can be used on metals, such as magnesium, titanium, zirconium, sodium, lithium, and potassium. And Class K is for combustible cooking oils, grease or oils such as vegetable oils, animal oils, or fats in cooking appliances. The PASS acronym is used to remember how to effectively use a fire extinguisher. So what does PASS stand for? Pull, aim, squeeze, and sweep. Pull the pin at the top of the cylinder, aim the nozzle at the base of the fire, not the flames, squeeze the top handle or lever to release the pressurized extinguishing agent, and sweep the nozzle from side to side at the base of the fire until it goes out. The PASS technique works for most fires, but not oil fires. Knowing the acronym can help you react quickly and confidently in an emergency, which can potentially prevent any further damage. Fire extinguisher maintenance. Fire extinguishers need to be shaken up once per month. Fire extinguishers also need to be inspected to ensure all parts and seals are intact regularly. Bloodborne pathogen safety. Bloodborne pathogens are infectious microorganisms in human blood that can cause disease in humans. These pathogens include, but are not limited to, hepatitis B, hepatitis C, and HIV. Bloodborne pathogens are transmitted when contaminated blood or OPIM enters the body. OPIM stands for other potentially infectious materials, such as other forms of bodily fluid. In the workplace setting, transmission is most likely to occur through an accidental puncture by a sharp object, such as a used needle, broken glass, or other sharps contaminated with the pathogen. Any item that has come into contact with blood or OPIM is a biohazard and should be disposed of as such to prevent infection. Hazard communication. All employers with chemical bottles in the workplace must have labels and safety data sheets for exposed workers and train them to handle chemicals properly. This is what our chemical labels look like. Hazard communication protocols are designed to protect employees from hazardous chemicals used or stored in the workplace. Proper training helps workers understand the chemicals they are exposed to and how to work with them safely. Globally Harmonized System of Chemical Classification and Labeling, or GHS, provides a consistent approach to classifying chemicals and communicating the hazards associated with their use. Safety Data Sheets, or SDS. The SDS contain information about hazardous chemicals, including properties, physical and health hazards, and safety precautions for handling, storing, and transporting. Ours are located near the MSC cabinets. What should an employee do if they bring a new chemical into the building? First, ask for the SDS at the store. Some places may not know, but it is the law that the store carry the SDS. Then bring the SDS to HR. If you don't have the SDS, bring in the bottle or write down what it is and give that to HR. Poison control numbers are located at the sink stations. What do the following pictograms indicate? Fire, pressurized, corrosive, health, environmental hazard. Finn-Kool has 4 first aid cabinets. They are located at the main bathrooms, the fabrication shop bathrooms, the mill west walk-through door, and the QC booth wall. Inside them you can find bandages, medical wraps, eye wash and eye drops, over-the-counter medication, ointments, creams, sprays, and a CPR mouthpiece. What should you do if you get a small cut on your hand and it's bleeding? Cover it with a clean cloth to stop the bleeding, clean the cut, and put a bandage on it. If you get a large, deep cut on your arm and it's bleeding, what should you do? Cover it with a clean cloth and apply pressure to stop the bleeding. Alert another person so they can help you. Alert management and determine if you should go to the hospital. And then when you are safe, see Human Resources to fill out a report. What if an employee falls to the ground and you're nearby, so you go to check on them? First, check to see if they're breathing and if they have a pulse. If the employee is not breathing and does not have a pulse, tell someone to call 911 and start CPR, or send for another employee who is CPR certified. CPR should be administered in the form of 30 chest compressions at a rate of 100 beats per minute, followed by 2 rescue breaths. Continue CPR until medical personnel has arrived. Switch with someone if you start to get tired. Do not leave this person alone unless it is absolutely necessary. What if an employee falls to the ground, you're nearby so you go to check on them, and they have a pulse and are breathing? Immediately ensure that the area is safe. Check for responsiveness and call for emergency help. Keep them calm, check for injuries without moving them unnecessarily, and if they're unconscious but breathing, place them in a recovery position to keep their airway clear. The recovery position is on their side with a leg bent to support the position, an arm bent to prevent rolling over, and a hand under the chin to keep their mouth open. Do not leave a person alone unless it is absolutely necessary. What if an employee falls to the ground, you're nearby so you go check on them, and you see that they are seizing? First, tell someone to call 911. Then clear the area around them to prevent injury. Place something soft and flat under their head to protect it. Turn them on their side so that they don't choke on anything, and then stay calm and talk to them until they recover. Try to note the time that the seizure starts and finishes, and remain with them until medical personnel arrive. Do not leave the person alone unless it is absolutely necessary. How to safely operate powered industrial trucks. Always wear your seatbelt on the forklift. Always operate the vehicle according to the manufacturer's instructions. Never exceed the rated load and ensure it is always stable and balanced. Do not raise or lower the load while traveling. Be aware of other vehicles and people in the area, and use horns at cross aisles and obstructed areas. Do not give rides or use the forklifts to lift people, and have clear visibility of the work area and ensure you have enough clearance when raising, loading, and operating a forklift. Do not stack loads to obstruct the view of the driver. If you must lift something that will obstruct the driver's vision, use a spotter for moving loads. Use proper footing and handhold if available when entering the lift. Only forklifts equipped with load backrest are authorized for high tiering, which refers to elevating a load 10 to 15 feet or higher. Forklifts not equipped with a load backrest are only authorized for raising loads approximately 4 to 5 feet from the floor and must not exceed the height of the forklift mast. Forklift training and maintenance. Safety training: only trained individuals may operate a forklift. Certified workers must be retrained every 3 years. Basic maintenance checks will be made by a designated employee daily, and any forklift found to be in unsafe operating condition will be removed from service. All employees should keep forklifts in clean condition, free of excess oil and grease. You have now completed the Finn-Kool annual safety training course.